Hi everyone, I'm Marina,
And I'm Brooke.
and today we'll be presenting our low back pain prevention class designed for exercise 3745.
We created this program by applying current research, using ACSM guidelines, and key course concepts to address nonspecific low back pain.
Step 1. Assess the case. Our program is designed for a general adult population without a formal diagnosis. We noticed a rise in members reporting low back discomfort, likely from poor posture, weak core, stability, and sedentary habits.
So our top priority for this case is to address core and hip stability over strength. Exercises will be scalable for all fitness levels with both progressions and regressions while avoiding high-risk movements like unsupported spinal flexion.
For step 2, gather additional data. The active straight leg was the first assessment we decided on. This tests core stability and pelvic control by having the participant raise one leg while keeping the other flat. It helps with assesses neuromuscular coordination and hamstring flexibility, highlighting weaknesses in muscles like the transverse abdominis and hip flexors, which are a key for spinal support. Poor performance here can show a risk of lumbar compensation during daily activities.
And the second assessment we decided to include was the hip mobility screen. The hip mobility screen evaluates range of motion in hip flexion, extension, and rotation using tests like the Thomas test and the Faber test. Limited hip mobility shown in this test can lead to lumbar spine overcompensation and back strain. Some key muscles evaluated here are the gluteus maximus, the iliopsoas, and the adductors. Identifying restrictions early helps us individualize the interventions.
For step 3A, research. For the first one, we had the Custer's 2024 article found that an 8-week program of hamstring stretching and core stabilization exercises significantly reduce low back pain and discomfort.
So as you can see here in Table 5, we see greater improvements in pain scores such as the VAS, lumbar discomfort, LBD, and hamstring flexibility, the straight leg raise, compared to the control group. Overall, this highlights the importance of targeting the hamstrings, core stabilizers, and posterior chain flexibility for the NSLBP.
For the second article, we picked the Kim and Ying 2020 article, compared combined core and hip strengthening exercises to standard care. The Table 4 shows a significant improvement in pain self-efficacy and psychological measures like depression and anxiety.
For this intervention, the muscles that were targeted were the hip abductors, the obliques, and the multifidus, emphasizing that strengthening these muscle groups improves both physical and mental outcomes in low back pain prevention.
For the third article, we picked the Planstoska. The 2024 article combined hamstring stretching, core control, and posture education in an 8-week intervention.
As you can see in Table 3, it showed that hamstring flexibility increased by about 7 degrees and sitting discomfort improved significantly. These outcomes reinforce the importance of hamstrings, glutes, and erector spinae and maintaining posture during prolonged sitting.
For our fourth article, we picked the Shamsi. The 2020 article compared core stability exercises to general fitness exercises. Their exercises enhance anti-extension and anti-rotation control, targeting muscles like the transverse abdominis, multifidus, glute med, and the internal exterior obliques.
And so overall, this study supports the idea that endurance and spinal control are more critical than just pure strength when preventing low back pain.
Now for the summary. Bringing all the studies together, our program emphasizes the combined importance of core stability, hip strength, hamstring flexibility,
as well as movement patterns. So training the core stabilizers, glutes, and hip rotators simultaneously provides the best outcomes for reducing nonspecific low back pain.
Bringing together the findings from all 5 studies, we can see consistent support for core and hip strength as essential elements in reducing low back pain. Kim and Ying, 2020, demonstrate that exercises focusing on core stability and hip strength significantly improve physical function and activity levels in patients with non-specific low back pain.
And similar to Kim and Yim, the Shamsi article highlighted the superiority of core stability exercises over general exercises when addressing muscle activation imbalances, further reinforcing the importance of targeted core training.
In addition, the Plandoska 2024 article points out the beneficial effects of hamstring stretching and core control exercises. Significantly for young individuals who experience discomfort from prolonged sitting, this emphasizes the flexibility and posterior chain mobility, along with core strength, are critical factors in elevating low back pain, especially in sedentary populations.
And another research article we looked at by McGill, obviously we talked about this a lot in class. It emphasizes the importance of exercise design, specifically advocating for exercises that resist extension and rotation to enhance spinal stability. And the research across all of these studies indicates that stability-focused training, which avoids excessive lumbar flexion or extension, is more effective than general fitness exercises, aligning with our approach of promoting safe and functional movement patterns.
Collectively, these insights guide our intervention plan, which is focused on improving movement control, reducing pain, and promoting confidence in motion through targeted core stability and flexibility exercises, as well as a careful attention to posture and movement mechanics. For step 3B, which is our warm-up, our warm-up is designed to generally activate the core and hips and increase dynamic flexibility. Each exercise targets muscles critical for the lumbar stability. So for the first one, we picked the standing hip circles, which activate the glutes and hip rotators. We did 3 sets and 5 on each leg. For the second one, we did toe touches, which stretches the hamstrings and erector spinae, also 3 sets for 10 seconds each. And for the knee twist, which mobilizes hip rotators and lower the obliques, which will be 3 sets, 5 on each side.
And then to continue our warm-up, we have the cat-cow stretch, which mobilizes the spinal extensors and abdominals. And for that, we have 3 sets of 10 reps. And then we have the child pose, which gently stretches lumbar extensors. And then for that, we also have 3 sets for 10 seconds. And then the last part of our warm-up will be the head to knee stretch, which stretches the hamstrings and lower back, which is also 3 sets of 10 seconds on each side. And all of these will prepare the spine and hips for stability work during the main session. And we followed the ramp protocol to do the proper warm-up.
For step 3B, for the first 1 to 3 exercises, they focus on anti-extension control and hip-driven stability. For the first one, we did dead bugs, which strengthens the transverse abdominis, promoting lumbar control against extension, 3 sets for 10, alternating each side. The next one was plank, which strengthens the rectus abdominis, obliques, and scapular stabilizers, supporting posture, 3 sets, 10 seconds. And for the third one, we did glute bridge, which activates the glute maximus and hamstrings to enhance posterior chain strength, which was 3 sets and 10 on each side. Each exercise builds spinal stability and movement efficiency without excessive load.
And then to continue with our targeted intervention for 3B, we have the bird dog, which trains the multifidus and transverse abdominis to resist spinal rotation. And for this, we have 3 sets of 10 reps alternating sides. Next is the standing hip abduction, which strengthens the gluteus medius, reducing pelvic drop and lumbar compensation. And we also have 3 sets of 10 reps on each side. And then the last exercise is the wall sit, which strengthens the quads, glutes, and core for static endurance under a neutral spine. Overall, this will build muscular endurance needed for long-term back prevention. All of the sets and reps we came up with were included in our sources on what is the ideal dose for these type of clients.
Next is step 4, which is education and follow-up. Education is essential to the success of this program. We'll teach neutral spine alignment for sitting, standing, and lifting through in class demonstrations and visuals.
We'll also send weekly motivational texts, use posters around the gym, and reassess flexibility and strength at the mid-program checkpoints to track improvements. And all of these strategies are designed to promote long-term commitment and spinal health.
Next, we did a visual summary. This flowchart shows the program's logical progression. We'll start with the dynamic warm-up, move into core and hip strengthening, integrate flexibility work, and reinforce learning through ongoing education and follow-up support.
And so here are the references we decided to use to build our program. We chose recent, high quality, and original research articles that align with professional exercise science guidelines and cited them with JSCR citations.
As in Stuart McGill emphasizes, true spinal protection comes from building core endurance and movement control, not just raw strength.
So the exercises like the bird dog and side plank focus on resisting unwanted spinal movement, keeping the back stable under daily demands. These principles shaped every exercise we selected.
Thank you.
Thank you.